Right, ladies and gentlemen, today we are going to talk about benign prostatic hyperplasia and carcinoma prostate. As per our usual routine, we will focus on morphological aspects more in this presentation. Now, starting off with benign condition, remember that there are two main things in normal histology of prostate: glands and stroma, and both proliferation of both component occurs in benign prostatic hyperplasia. So it's both. Remember that it's both stromal and glandular elements that show the process of hyperplasia, and the process is mainly derived by the activity of a derivative of testosterone, and that is known as dihydrotestosterone, okay, DHT, abbreviated as DHT. It is the major hormonal stimulus, and remember that grossly speak, the BPH, benign prostatic hyperplasia, affects mainly the inner periurethral zone or the inner transition zone of the prostate, that lead to compression of prostatic urethra and result in difficulty in initiating the stream of urine. That is usually the first complaint of the affected patients. Upon gross examination, we'll see the pictures later on, but on gross examination, there are nodules. Remember that there are nodules, and appearance of which varies according to the cellular content. That is, whether it's more of a glandular hyperplasia or more of a stromal hyperplasia. When it's more of glandular component that's present, they kind of look like yellow pink, soft in consistency. But when they're composed mostly of fibromuscular stroma, they're pale gray and firm in consistency. So this is the major difference in cross examination. Upon histology or microscopic examination, there is a variable proportion of stroma and glands. If they're glands, they may be small, they may be large, but they may be cystically dilated. But the major histological finding that differentiates it from cancer is that they are lined by two layers of cells. Okay, so this is the major difference, differentiating this from cancer. Now, adenocarcinoma, most of the cases, remember, arise in the peripheral or the outer zone of the prostate, classically in the posterior location, most of the cases, that is, and that is why they are palpable on rectal examination. And this is the first investigation which you do with respect to clinical exam, which aids in the diagnosis, of which may point towards the diagnosis of prostatic enlargement, and if enlarged, a suspicion of carcinoma. Now, upon gross inspection, when we receive a specimen, the cross section is usually firm in appearance, firm in consistency. When we feel it in the lab, it's usually firm in consistency, not usually soft. So this is how we differentiate it from the surrounding hyperplastic prostate. Gland microscopy of adenocarcinoma. The glands are usually smaller than benign glands, and yes, as we previously noticed, the major difference here, there's a single layer of epithelium. There may be cuboidal, may be columnar, but single layer, the outer layer of myoepithelial cells is lost, and the glands appear more crowded, and they lack branching and papillary enfoldings that are sometimes seen with benign prostatic hyperplasia. The cytoplasm varies. It may be clear, it may be amphiphilic in appearance, and nuclei are generally large, and they may show large prominent nucleoli as well. Now, this is a comparison of gross morphologies of benign and malignant prostate glands. On this side, you see a fairly nodular appearance of the gland, and yellowish white appearance. There are small cystic areas as well. But on this side, you see this part is the benign portion grossly, and this portion has lost its kind of cystic or spongy appearance or softer appearance and has become firm. So this is how we look for cancer on gross specimens when it's received in the lab. So this area represents is likely. It's not necessary. If I say that it's a new specimen and I don't know that from where the picture has been taken, so this, I would say that this area most likely represents a cancer, and then it's confirmed on histology, of course, only. Then regarding histology, these two are photomicrographs of benign prostatic hyperplasia. You can see here the nodular appearance you noticed on cross examination, and here you see those glands and surrounded by fibromuscular stroma. So these are the glands, and here inside those glands you see something that is known as corpora imalasia, and then these areas show the stroma. Okay, here this all is the stroma. In this example, it's more of glands in comparison to stroma, but if we had other pictures, there may be more stromal areas as well. Okay, here you see there are some papillary infoldings, that is there are infoldings of epithelium into its own lumen in the form of papilla containing central fibrovascular core. These are the prominent features of benign prostate hyperplasia. This is a photomicrograph. This is a diagrammatic representation of benign prostatic hyperplasia. You can see all the prominent features. You must remember a feature that is not fairly appreciable on this power is that they are lined by dual layers of cells, double layer epithelium. This has been shown here in this diagrammatic representation. Now this is an example that shows both benign and malignant glands. You can see this is a fairly benign gland, and these glands in the center are the malignant ones. You can see the change in color of cytoplasm. You can see here there are multi-layered, this appears multi-layered. Here there are dual layers of cells as well, but here it's a single layer of cells, and which on high power look like this. You can see in the upper portion, this is a benign gland. This is showing two layers of cells, this one and the surrounding layer of myoepithelial cells, that is this one. And here in the center, these are malignant glands. They're lined with single layer of cells. If you look at this gland, for example, the nuclei are enlarged, the nuclei are prominent, and the cytoplasm is kind of amphiphilic. So these are the features of prostate adenocarcinoma. This is a diagrammatic representation of prostatic adenocarcinoma. Here I've shown I've shown perineurial invasion as well. This can be seen in many of the prostatic adenocarcinoma cases, and it's a very helpful. It's part of a report, or it's essential part of report actually when we sign out prostatic adenocarcinoma cases. Okay, and you can see here the glands are back to back. They're kind of very close together with no actually stroma in this at this place, and very little stroma when we see here and here. And this feature has been shown here, that it's written here as well, back to back microacini means that there is very little intervening stroma. This has also been mentioned on this side as well. So these are the main features. This is it for now. Please let me know if you have any question. Thank you.